Hello students. The topic we'll be seeing today is mechanism of tooth eruption from oral histology. The contents of this class will be about eruption, clinical crown versus anatomic crown, active eruption versus passive eruption, stages of passive eruption, and its classification according to Gottlieb and Orban and Coslet, and then mechanism of tooth eruption. What is eruption? It is the cutting of tooth germ through the gums. Rate of tooth eruption depends on the phases of tooth movements. The intraosseous phase is 1 to 10 micrometers per day, and the extraosseous phase is 75 micrometers per day. Clinical crown versus anatomical crown. Now, this is a very often asked MCQ, so kindly pay attention. You can see in this image, this part is the clinical crown. That is the exposed crown extending from the cusp tip to the gingival attachment is the clinical crown. It is so named because only this part we can see clinically. Anatomic crown is the entire crown extending from the cusp tip to the cemento-enamel junction. Active eruption versus passive eruption. Movement of the tooth from the development site to its position in the arch is active eruption. Passive eruption does not involve tooth movement but occurs apical to recession of gingival tissue, exposing more tooth structure into the oral cavity. Stages of passive eruption according to Gottlieb and Orban. There are 4 stages. This is a very important and often asked MCQ in AIMS and PGI. So students, please pay attention. Stages of passive eruption. Stage 1 is the dentogingival junction is located on the enamel. Here. The dentogingival junction. That is the junction between the gingiva and the tooth is located on the enamel, this tip. Second stage, the dentogingival junction is located on the enamel as well as on the cementum. See here, it is located on the enamel as well as on the cementum. Third stage, the dentogingival junction is located entirely on the cementum, extending coronal to the cemento-enamel junction. This dentogingival junction is located on the cementum, but it is coronal to the cemento-enamel junction. Cemento-enamel junction is here, and this dentogingival junction is a bit coronal to it. And the fourth stage, the dentogingival junction is located entirely on the cementum, and the root surface is exposed, resulting in gingival recession. These are the stages of passive eruption according to Gottlieb and Orban. Kindly make a note of this along with the diagram. Now there is something called stages of altered passive eruption. This is given by Coslet. This is also a very important one-word concept from AIMS point of view. Again, there are 4 stages of altered passive eruption, and all types are present with the free gingival margin located occlusal to the cemento-enamel junction. It is divided into type 1A, 1B, 2A, and 2B. Type 1A, wider band of dekeratinized tissue at the alveolar crest, and the cemento-enamel junction is normal. It is equal to 1.5 mm. First image, wider band of dekeratinized tissue, and the alveolar crest to CEJ is normal. That is equal to 1.5 mm. Type 1B, second image, wider band of dekeratinized tissue, and the alveolar crest to the CEJ is more or less equal to 0 mm. See the gap, more or less equal to 0 mm. Type 2A, normal band of dekeratinized tissue, and the alveolar crest to CEJ is normal, again 1.5 mm. Type 2B, normal band of dekeratinized tissue, and the alveolar crest to CEJ is 0 mm. Note down this also along with the diagrams, which is wider band of dekeratinized tissue, which is a normal band of dekeratinized tissue. You should be able to differentiate. Type 1 is always wider band and type 2 is always a normal band of dekeratinized tissue. If it is A, the alveolar crest to CEJ is normal, both in type 1 and type 2. If it is B, the alveolar crest to CEJ is 0 mm. Mechanism of tooth eruption or theories of tooth eruption. We can speak about bone remodeling theory, root formation theory, vascular pressure theory, periodontal ligament traction theory, and the role of dental follicle in tooth eruption when it comes to mechanism of tooth eruption. So there are 5 theories. Bone remodeling theory. Growth pattern of maxilla and mandible moves the teeth by selective resorption and deposition of bone. This is what bone remodeling theory has to say about the mechanism of tooth eruption. Root formation theory. The root formation may be a necessary prerequisite for eruption. Cushion hammock ligament is mentioned in the root formation theory. The function of this ligament is it provides a strong base for the growing root. Vascular pressure theory. Rich vascular supply between the teeth and the bony structure generates an eruptive force. Periodontal ligament traction theory. Formation and renewal of periodontal ligament fibers has been considered a factor in tooth eruption because of the traction power that fibroblasts have. This force is transmitted from the extracellular compartment to collagen fibers, which is aligned in an appropriate inclination to bring about tooth movement. Role of dental follicle in tooth eruption. Removal of dental follicle prevents tooth eruption. This is actually true. We are ending this class here. Moving on to MCQs. First question. Entire crown extending from the cusp tip to the CEJ is called dash. Option A, clinical crown. Option B, anatomical crown. Option C, either A or B. Option D, neither A nor B. The answer is option B. Entire crown extending from the cusp tip to the CEJ is called anatomic crown. If it extends from the cusp tip to the gingival margin, it is clinical crown. Second question. Which theory of tooth eruption speaks about cushion hammock ligament? Option A, bone remodeling theory. Option B, root formation theory. Option C, vascular pressure theory. And option D, periodontal ligament traction theory. The answer is option B, root formation theory. That's all for this class, students. Thank you.